A distinct clinical profile frequently presents in modern medicine: a patient possessing superior working memory and intense cognitive focus, who simultaneously suffers from an inability to downregulate their nervous system. Under even mild stress, their executive function collapses. Beyond the psychiatric symptoms of chronic hyperarousal and anxiety, this same patient often presents with physical pathologies, including functional pain syndromes and chronic cyclical symptoms driven by systemic estrogen dominance. Curious, analytical question: what underlying biological mechanism unifies these highly disparate psychiatric and somatic pathologies? The unifying mechanism is a single genetic variation. It is a widely researched non-synonymous single nucleotide polymorphism known as RS4680, located within the COMT gene. This mutation severely compromises the catechol-O methyltransferase enzyme, the biological toll booth tasked with degrading excitatory catecholamines and catechoestrogens. The RS4680 mutation reduces the enzyme's functional clearance capacity by up to 75%. Localized medical models often fail these patients because they address symptoms in isolation. This mutation generates a systemic gridlock that simultaneously paralyzes three distinct biological networks. The blueprint for the COMT enzyme is located on chromosome 22q11.21. In human populations, a specific base pair transition frequently occurs at codon 158. A single guanine nucleotide is swapped for adenine, which replaces the amino acid valine with methionine. This minor amino acid substitution destroys the structural integrity of the resulting protein. At normal physiological temperatures, the enzyme becomes highly thermolabile. It destabilizes and degrades before it can perform its job. Individuals homozygous for the valine allele maintain a highly active, stable enzyme that rapidly clears neurotransmitters. Individuals who inherit two copies of the mutinated methionine allele possess the slow COMT phenotype, leaving them with an enzyme operating at a massive deficit. Because this specific enzyme is the mandatory clearance pathway for multiple compounds, its structural failure creates a biological bottleneck. Excitatory neurotransmitters and hormones that should be neutralized and excreted are instead trapped, pooling in the synaptic cleft and the peripheral bloodstream. In subcortical brain regions, excess dopamine is cleared by dopamine transporters, but the prefrontal cortex, the region governing complex decision-making and working memory, lacks these transporters. It relies almost entirely on the COMT enzyme to terminate dopaminergic signaling. This chart visualizes the Yerkes-Dodson law of optimal arousal. It plots dopamine concentration on the x-axis against executive function on the y-axis, demonstrating that cognitive performance requires a highly specific, optimal peak of dopamine. Under calm, resting conditions, the sluggish enzyme of a slow COMT carrier allows dopamine to naturally pool in the prefrontal cortex. This elevated baseline positions them exactly at the optimal apex of the curve. Fast metabolizers, by contrast, sit much lower on the curve, aggressively clearing dopamine and leaving their baseline cognitive function comparatively suboptimal. The environment dictates whether this is an advantage. When exposed to an acute stress event, the brain releases a surge of catecholamines. For the fast metabolizer, this surge provides the exact amount of dopamine needed to push them up to the optimal peak. For the slow metabolizer, the exact same chemical surge pushes their already optimal dopamine levels over the precipice and into dysfunction. Clinical trials using the flanker task prove this double dissociation. Under mild social evaluative stress, fast metabolizers improve their focus and selective attention, while slow metabolizers experience a collapse of working memory. The sluggish enzyme cannot clear the flood of neurotransmitters rapidly enough. The cognitive brilliance of the slow COMT individual is entirely conditional, requiring strict environmental buffering to prevent neurological paralysis. The inability to clear catecholamines impacts the peripheral nervous system with equal severity. Genetic testing reveals that 66% of patients suffering from functional pain syndromes, such as fibromyalgia, harbor low-activity COMT variants. Without adequate enzymatic breakdown, excitatory chemicals like epinephrine accumulate in the peripheral circulation. This sustained elevation perpetually agonizes both beta-2 and beta-3 adrenergic receptors throughout the body. Prolonged activation of these specific receptor subtypes forces the peripheral nervous system into a state of systemic inflammation and profound tactile allodynia, where standard mechanical pressure registers as pain. This table details the genetic pain haplotypes formed by COMT variants. The high pain sensitivity haplotype, defined by the ACCG allelic sequence, dictates the lowest enzymatic activity. This directly associates the slow COMT structural deficit with extreme vulnerability to clinical pain phenotypes. Because the slow enzyme also suppresses the natural production of endogenous painkillers like enkephalins, the nervous system attempts a biological workaround by upregulating the density of mu-opioid receptors. This compensatory mechanism is physically flawed. The signaling pathways of these receptors in the slow COMT genotype are exceptionally weak. If exogenous opioid medications are administered, the patient paradoxically registers increased pain sensitization, a state known as opioid-induced hyperalgesia. Chronic idiopathic pain in these patients is a direct consequence of prolonged adrenergic receptor bombardment. The slow clearance of epinephrine creates a persistent state of physical hypersensitivity, independent of external tissue damage. In human hepatic tissues, the COMT enzyme anchors the phase 2 liver detoxification process. It is the mandatory gatekeeper for the safe elimination of primary circulating estrogens. During phase 1 detoxification, cytochrome P450 enzymes hydroxylate circulating estradiol. This forms several intermediate metabolites, most notably 4-hydroxyestradiol, a highly reactive and unstable chemical. This flowchart maps the estrogen detoxification pathway. A highly functional COMT enzyme immediately intercepts 4-hydroxyestradiol, neutralizing its toxicity. In the slow COMT phenotype, this critical O-methylation process is dangerously delayed, causing the reactive intermediates to pool inside the cell. Stuck behind the enzymatic bottleneck, the unmethylated 4-hydroxyestradiol undergoes spontaneous oxidation. It converts into estrogen quinones, highly aggressive electrophilic free radicals. These estrogen quinones actively seek out and bind covalently to cellular DNA. The formation of these adducts destabilizes the DNA backbone, causing the purine bases to detach. The cell's subsequent attempt to repair these lesions generates critical mutations. The failure to clear estrogen metabolites causes clinical estrogen dominance and severe cyclical pathology. More critically, the intracellular accumulation of these specific metabolites directly initiates the mutations responsible for hormone-sensitive malignancies. The COMT enzyme cannot operate in isolation. It relies entirely on S-adenosine methionine, or SAME, as its universal methyl donor to process these compounds. The broader methylation cycle governs SAME production. If an individual inherits a compounding upstream mutation in the MTHFR gene, their folate cycle is restricted. This effectively starves the already sluggish COMT enzyme of its mandatory fuel, exacerbating the toxic buildup of neurotransmitters. Clinicians frequently attempt to treat this dual defect by administering high-dose direct methyl donors like methylfolate. However, for a slow COMT patient, this intervention produces a severe neurochemical backlash. This induces an over-methylation response, where excess methyl groups back up behind the enzymatic bottleneck. These groups hyperactivate secondary pathways, triggering sudden onset anxiety, racing thoughts, and severe central nervous system overstimulation. Furthermore, the slow O-methylation process allows S-adenosine homocysteine to accumulate in the cell. This byproduct acts as a toxic, competitive inhibitor that binds to the COMT enzyme and further halts catecholamine degradation. Attempting to aggressively push the methylation cycle forward in a slow COMT patient creates a biochemical negative feedback loop. The excessive methyl pressure creates an inhibitor that entirely halts neurotransmitter clearance. Managing the slow COMT phenotype requires precise biological traffic control to prevent enzymatic gridlock. The foundational step is the complete elimination of dietary compounds that competitively inhibit the enzyme. This table categorizes dietary flavonoids based on their physical structure. Flavonoids possessing a catechol structure, such as quercetin or EGCG extracted from green tea, physically mimic the body's endogenous catecholamines. They occupy the active site of the COMT enzyme, effectively hijacking its limited processing bandwidth. Chlorogenic acid, highly concentrated in coffee, demonstrates an exceptionally high binding affinity for the human COMT enzyme. This makes standard coffee consumption highly disruptive for these individuals, completely independent of the adrenal stimulation caused by caffeine. To support the enzyme without inducing overmethylation, clinical management pivots to a strategy known as methyl-sparing. The liver's endogenous synthesis of creatine consumes roughly 40% of the body's total systemic methyl groups. Administering a low daily dose of exogenous creatine powder halts this endogenous synthesis. This massive biological demand is removed, and the freed same is safely redirected to support the sluggish COMT enzyme. To bypass the estrogen clearance bottleneck in phase 2 detoxification, the compound diindolylmethane, or DIM, is utilized. DIM actively steers cytochrome P450 enzymes to convert estrogen into benign metabolites, drastically reducing the volume of toxic 4-hydroxyestradiol gevurated. Phase 2 clearance is then anchored with calcium D-glucarate. This compound inhibits beta-glucuronidase, an opportunistic gut enzyme that severs the chemical bonds of processed toxins. Calcium D-glucarate ensures that once the liver processes the estrogen, it remains bound and is permanently eliminated through the digestive tract. The slow COMT polymorphism dictates an environmentally sensitive biological profile. By removing competitive dietary inhibitors, sparing existing methyl groups, and clearing the hepatic pathways, the metabolic gridlock can be resolved. This allows individuals to leverage the profound cognitive advantages encoded in their DNA while maintaining physiological stability.